Welcome to Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance, including the PACE program. Today I am really excited to I have two, not one, but two doctors with me today because I've been wanting to get information on about oral health for years, and finally we have done it. So we have Dr. Helen Nguyen,
Yeah.
and we have Dr. Kayla Tam with us. And they are dentists with Cambridge Health Alliance. So, welcome.
Thank you.
Thank you for joining me
Thank you for
today.
having us.
This is an all-important subject that I don't think people really get the whole breadth of how important it is. In my experience, I deal with a lot of people that don't have a lot of money. And so, in my experience, if they have to choose between meds and food, they're struggling with that. And sometimes they let their teeth go. And I think they think it's just cosmetic, but it's much more than that, isn't it?
Yes, I agree.
Absolutely.
Yeah.
So,
It's absolutely important. Oral health is a very important part of your general health. And I think one of the most important things for that is to actually have a dentist that you can go to, a provider, or what we call a dental home.
a dental home?
A dental home. That's what we
dental
call
home.
it. Yes. Everyone should have a dental home. And so for us, we're residents. We're dentists, meaning we have our license, or a limited license, and we've graduated from dental school. We're fully trained, fully practicing dentists, general dentists, and we are part of the residency program at Cambridge Health Alliance, in conjunction also with the Harvard School of Dental Medicine. So for anyone out there who needs a dental home, they can be seen either at Cambridge Health Alliance or the Harvard.
And that would be the Windsor Street clinic,
Yes,
right?
that would be Windsor Street. That's 119 Windsor Street here in Cambridge. And Harvard School of Dental Medicine is located at 188 Longwood in Boston. So there's two options, one in Boston, one in Cambridge, whichever suits you. I will say that for the Cambridge Health Alliance, the Windsor Street clinic, you do have to be a patient of Cambridge Health Alliance to be seen there. At Harvard, that's not the case.
That's good.
Okay.
That's good, important information to know.
And the other thing is we accept pretty much all major dental insurances, including Mass Health.
Okay, great.
Okay.
Now, and they don't need a referral from a primary care to come to the dental clinic. Is that correct?
That's correct. They do not need a referral. We are considered primary care for oral health. So as long as you want to be seen, you can be seen. Yeah.
Great. So, so let's talk about some of the conditions of the mouth, right? We have a lot going on in there, haven't we? And if we don't have a healthy mouth, what are some of the things we might have?
So if you don't have a healthy mouth, you might have, pain. If you have some cavities that are getting deeper, you have sensitivities to cold, hot, sweets, those are some indications that you might have a cavity. Obviously, gum disease or periodontitis is one of the biggest things that affects, seniors. That's basically your gums are, basically throughout the day when you eat, you develop plaque. If you don't brush that off every day or clean it off with floss, then that hardens into calculus, which stays under the gums, and that causes inflammation and infection, and it makes your bones pull away, and your gums are really puffy. And that is basically chronic
and do they
inflammation.
bleed?
Yeah,
all that.
bleed.
Yeah.
Yep.
So you would not be able to miss that.
Yeah.
No.
Your mouth might taste bad, it might smell bad, these are the things that you might notice. And it doesn't happen overnight. It happens over time. So, brushing, maybe you miss today, okay, but then you miss a week or a month, and then, it just gets worse. And so that's why it's important to have this dental home that Dr. Tam talked about, because we want to catch it before it grows into this problem. Because if we catch it early, we can do things to stop it where it is and, get your health back. But if it goes too far, then you have it progress, and then you may lose your teeth.
Right. My father had every tooth in his head, and he did not have one cavity.
Wow.
And he got periodontal disease.
Pyorrhea, that's what they used to
I don't
call
know if they still use that term.
We don't use that term anymore, but that's what it's used to.
Periodontal, that's what we call it, right? And so he got that, and every tooth had to come out of his head.
Yeah.
Because of that. And they were all beautiful teeth. I mean, they
Exactly.
looked like
Yeah.
beautiful teeth.
It's not just about cavities, unfortunately. It's about your gum health, and we see a lot of patients actually that don't have a single cavity in their mouth, but they have severe periodontal disease, and vice versa.
So, and the brushing and the flossing helps because when you floss, you reach up under there.
Yep. So floss can reach about 3 millimeters under the gums, anywhere from 1 to 3. Toothbrushing and flossing can do that, but if you have, areas that are deeper than that, then you're not able to clean them at home, and that's why we need to clean them in the dental setting.
And that happens usually with your cleaning every 6 months?
So if you have periodontitis or this gum disease, then we basically want to get the debris out from under the gums and hope your gums shrink back to a healthy state. So it would be what some people call a deep cleaning. You would get numb and get under there to get all that stuff out.
You'd be really up there.
Yeah. So you probably don't want us in there without some anesthetic.
Right.
Yeah.
But I didn't know that. So that's why we do the show. So that's very good that with some deep cleaning, it could prevent it from going any further.
Right.
And that's
Yeah.
the
That's
hope.
the goal. That's the
That
goal.
is the goal.
Yeah.
That is correct.
Yeah.
I'll say one more thing about what could happen in the mouth. We usually divide it into 2 categories. 1, what we call acute, and then 2, what we call chronic. And there's very different things in terms of acute versus chronic. I'm not going to go into all of them, but basically something that would be acute would be something that develops very fast, that you may need to be seen immediately for, and then chronic would be something that's occurring over a long period of time. And so most of the things that we see in the dental setting in the clinic is chronic.
Really?
It is, yes.
I'm
Dental
surprised.
disease
I thought you were going to say acute when you have
No.
that incredible pain that
I mean,
drives
that
people.
certainly does happen. That certainly does happen, but most of it is chronic, what we categorize as chronic. And that's why a lot of patients feel like, well, I have a little bit of pain in my mouth, but it's not, it's not killing me. So I'm just going to wait and I'm going to hold off on my dental
Until
care.
it does kill me.
Until it does, until it blows up on you. And so also a lot of patients go many years without seeing a dentist, and then once they get there, they realize there's a lot going on that's been, taken years to build up. So there's those 2 main categories, and there's when it comes to preventing them, it's all the same. The strategy is the same.
Yeah.
Brush and floss.
Flossing, regular dental visits.
Prevention is key.
Yeah.
It is to everything.
Yeah.
Every professional, every clinician that I've had sit in this seat, whether we're talking about brains, feet, or anything in between, it's always good to get get anything early rather than to let it go on, because the problem becomes much bigger when we let it go on, and not only much bigger,
Much more expensive.
much
too.
more painful.
Painful and expensive.
Yeah.
And expensive. That's the other piece of it.
That's right.
Because, for example, let's say you get a small cavity, we can put a nice little filling in there, get you on your merry way, keep that going for 5-10 years if you keep good care of it. But if you let it grow, it gets into the nerve space, you may need a root canal, crown, or you may end up losing the tooth and then needing an implant, a crown on that. So if you think about those costs, a filling maybe $200, let's say, an implant is thousands of dollars. So it also can...
Everybody seems to want implants today. Everybody wants an implant. Is there, and since I work with the older population, they call us now older adults. Since I work with the older population, I have a woman at 87 who's talking about an implant. Does that make sense?
It depends on the situation. People are living longer these days. She could go on with that implant for who knows how long. It just depends on the circumstance.
Would a bridge do the same job?
It can in some cases, but there are also, if the teeth next to it don't have anything going on, you have to basically take away tooth structure from those teeth to place a bridge. So, yeah. And sometimes it ends up costing about the same. So you may want to go for the implant instead of hurting the 2 teeth next to it.
So at Windsor Dental Clinic, do we do implants? Do we do all of those procedures?
No, actually at Windsor Dental Clinic we do not place implants, but we can restore them, meaning we don't restore them either.
No, not at Windsor.
Oh, okay.
Yeah.
So, sorry, we don't restore our implants at Windsor either, but we do that at the Harvard Dental Center. Yes.
And do they do implants as well at Harvard?
Yes,
Yeah.
they not our clinic specifically. We restore the implants, meaning we put the crown on top, but we can refer you to the right place to actually get the implant.
And it's still within Harvard.
Still.
So
within.
what is an implant? Is it like a post that's drilled up into the bone?
So I like to think of an implant as 3 parts. One part is basically the part that you talked about, the piece that goes into the bone.
Post.
Exactly. And that acts like the root of the tooth. And then the other piece is it connects with the implant and kind of gives you some structure. Like if you have a crown, you have some tooth that's supporting a crown. And then a crown goes on top of that. So those are the 3 pieces that work together to restore a full tooth with an implant.
But I thought, so unless I misunderstood you, I thought an implant was you take the tooth totally out. The root is out.
Yep.
The post goes into the bone. But so then what first crown were you talking about?
So
I'm
it's just a
confused.
connection type of piece that gives you something to put the crown on top of, and it connects to the bone. It kind of like or the implant that's in the bone. It screws into that.
It screws into it, and then the crown gets cemented onto
on top.
that.
Yep.
That's right.
Okay, I understand that now.
Yeah.
So three pieces. So it's no wonder it's expensive, right? Yeah.
We call that piece the abutment. I don't know if people out there know that term, abutment. It's just a
Is the middle
connector
piece.
between the tooth and
The 2 pieces.
Yeah.
Like building Legos.
yes, exactly.
Yep.
We all have kids and grandkids, I'm sure, that we know these Legos. So when we there are other kinds there's a lot of bacteria that the mouth holds, right?
One of the dirtiest places.
One of the dirtiest places. And so we want to constantly keep our mouths clean. Now, our mouths are affected by things that we eat, things that we drink. We already talked, they're definitely affected by oral hygiene or lack thereof. Anything else? Oh, what about the stomach? The acids that might come up from the stomach, does that affect our mouth?
Oh, absolutely. GERD is a big factor a lot of times in what we see.
GERD, I just want to explain,
GERD,
is acid reflux.
Yes, acid reflux, big factor in some of the things that we see in the dental clinic because that acid actually wears away enamel. And so a lot of times if we see acid erosion, that may be indicative that the patient has uncontrolled acid reflux.
So there are lots of things that you can tell by the mouth
Absolutely.
that may have not been diagnosed yet,
Absolutely.
which is why I guess you're part of primary care.
Yeah, I guess you could say that.
That makes
I guess
sense.
you could
It
say
all
that.
fits together now.
Yeah.
Right, the
I guess
puzzle.
you could say that.
Yeah.
Do you anything to add about the stomach?
The stomach, not particularly, but I just wanted to say with the older adults, they're on a lot of medications, a lot of polypharmacy, and that has a tendency to dry out the mouth. And saliva is one of our most protective factors in the mouth for both, washing away the debris that we have throughout the day. And so with that, dry mouth is one of the biggest things that's going to cause your cavities, your gum disease, all of that. So
Why? Because anything we eat kind of just stays in the teeth?
yeah, there's not that buffering factor of the saliva there. So saliva is one of the most protective things. If you have a lot of it, that's great. You're less likely to get the cavities and the gum disease. But if you're on a lot of medications, you tend to be more dry. So that's one of the things we're seeing with older adults that puts them at a higher risk for getting cavities.
So even if they increase their fluid,
So
would that help? Well, it might help. Or if they increase their oral hygiene, that would help.
So when someone has this dry mouth syndrome, basically we recommend they increase their fluoride. They drink more water. Use those supplements like biotin to help hydrate the mouth. And also we actually recommend them to come in more often than the recommended, general 2 times per year, because that's just a general type of thing. But we recommend them to come in more frequently to make sure we're on top of things.
Wow. Now, so that's good to know for us. Now, can medications also affect the teeth?
The teeth.
The
I know they
teeth,
can
yeah.
dry the mouth out,
Yeah.
but can
Yeah.
they also? Do they also have any effect on the teeth?
There are certain drugs that can affect the teeth directly. So, one example is the popular antibiotic tetracycline,
Oh, yes.
which can cause basically staining of the teeth and sometimes also deformities in the enamel. But I don't think there's really any medication or drug that will cause, for example, decay directly.
Right.
Most of them cause them indirectly by reducing the salivary flow. And, water is not the same as saliva, though. It does not have the same protective factors. Most of the time, the things that we do for dry mouth is actually to try to stimulate more saliva from the patient.
How do we do that?
So, I mean, one of the things is, lozenges that just naturally produce more saliva when you have that lozenge in your mouth. It just stimulates the saliva to
Making sure it's
produce-
sugar free though.
Yeah,
Sugar-free.
sugar-free. Yes, sugar-free, absolutely. There's something called
Oh,
xylitol.
sugar. That's an important thing we need to talk about.
Yes, absolutely. So, again, we try to stimulate the saliva back as much as we can because that's where all the protective factors are.
And if it gets, there are certain people that might qualify for a medication that can help, induce more saliva, but that's up, you want to be with your dentist and maybe your primary care doctor to talk about that.
So let's talk about sugar. or anything. What about carbohydrates that turn to sugar in the body? Those affect the teeth as well. So sugar, although except for diabetics, it has seemed like a pretty benign substance. Yet it seems to cause a lot of problems. Right?
Yeah.
I know that white flour and white sugar create inflammation in the system and in our systems, and inflammation causes disease. So inflammation with swelling and pain and tightness and stiffness and redness and all that stuff that's not so fun. So sugar in the eating a lot of sugar. Well, here we are at one of the chocolate holidays.
Yeah.
Right. And people may consume a lot of sugar on this weekend coming up, and chocolate usually, right?
That's right.
So it's okay. It's okay to have a limited amount of sugar, or how do you folks feel about sugar?
Yeah, that's a tough question. I mean,
Yeah.
what I will say is, like you mentioned, you said sugar seems to be benign compared to a lot of other things out there, like smoking and tobacco and alcohol, things like that. But we're entering kind of an era now where we think sugar is just as dangerous. Not only for your oral health, but obviously your general health as well, because it's so prevalent and so kind of in your face everywhere. Sugar is in every snack, every drink imaginable.
Everything. When I read the ingredients in my garlic pepper, there was sugar in there. I was aghast that they would put sugar in my garlic pepper. But you do really have to read the ingredients
Yes.
because they sneak it in, and sugar is an addictive substance.
Exactly.
So when you have sugar, you want more sugar.
Exactly.
And sweeteners, I think, make you crave as well.
Yes, sweeteners. There are certain sweeteners that are like xylitol that I mentioned before that are can actually help your oral health. I'm not sure about general health if that's different than regular sugar, but generally
Are you
speaking,
saying XY?
yes, XY xylitol.
Oh, XY,
like-
xylitol.
Yeah, you find that commonly in like gums and mints
Yeah.
and things like that. But generally speaking, sugar is an addictive substance that you can consider being basically abused these days.
It is abused
Basically
these
abused,
days.
yeah.
And I think it's the wonderful world of retail, and it entices us to buy more. So, of course, that's why they put it in.
Exactly.
Then when we get hooked on it, we want more.
And I'll just say to the people, to the viewers out there, the next time you buy whatever drink it is, it could be, in the morning, a coffee or something like that, look at the sugar content and you will be probably shocked as to how much there is
Right.
in there.
You know, I know we've had sort of a heightened awareness around sodium.
So
And we have to look at the ingredients for sodium as well, because that also preserves the food and makes it taste good, whatever.
That's right.
But I think we're just getting around to the sugar.
Yeah.
You know, I'm off flour and sugar now for a few years, and the interesting thing is that I tell people there were 2 side effects that I did not expect, and both good. The first side effect is that my cravings went away. Off flour and sugar, I no longer have cravings. So people say, "Oh, I hate to eat this in front of you." It's like, it's okay. And the second thing that happened to me, which I had no idea was going to, is that, and often we eat with our eyes, right? If something looks good, we want it. If it doesn't look good, we don't want to touch it. So the miracle that's happened to me is that, you know, if something looks good and I hear it calling my name, then I try a little tiny taste. The interesting thing is that it no longer tastes the way it used to, because your taste buds change.
Yeah, they do.
And that was the beauty of that whole thing. So now if I get something that has sugar, I get the shivers from it, because it's way too sweet for me. So there might be a little bit of a transition to get from point A to point B, but once you get there, our taste buds get used to anything, don't they?
That's right.
Yeah.
That's absolutely right.
And I think it's about balance, really. You know, I'm not going to say to everyone, just stop eating all candies, all sugars, all everything, because that's not fair. But
not realistic either.
Yeah, it's not realistic either. But I think it's more about, you know, just being mindful of how much you're having, and also being mindful of the types of sugar you're having. Something that's really sticky, like caramel, that's going to stay on your teeth and make you more likely to have cavities. Whereas something like, let's say, dark chocolate, it just melts away more so. And so those are less sticky. Like gummy bears, really sticky. You know, what else other than dark chocolate?
What about these gummy vitamins that I see? Are they also
They
culprits?
also have sugar.
They have a lot of sugar.
Yeah.
Right.
And also the vitamin C gummies, they also have acid. So
And
there are
acid
people.
affects the teeth. The enamel. Now, once we lose enamel, we can't put it back,
No.
right? It's gone. Once
Nothing
it's gone,
we can do.
it's gone.
It's gone.
For now.
Yeah.
Researchers are working on that. But for now, it's gone.
Yeah.
Right. So, do we have anything else to talk about infections? If not, I'd like to go to these whitening.
Sure.
Yeah. Go ahead.
So we have all these commercials showing us white teeth, bright teeth with all the little diamonds and everything. They have all kinds of over-the-counter whiteners, which I'm not sure they do anything, actually. You could probably tell us better. But are those harmful to the teeth, the whiteness?
They can be.
I mean,
It's not like very harmful, but it can be if you're not using it correctly.
so the ones that you find over the counter in the stores, 99% of them are a form of peroxide. So either what we call
peroxide.
peroxide.
So
It's
we
a
might as
form
well
of
just brush with peroxide.
I mean, it wouldn't necessarily be the same, but they're different formulations of peroxide: hydrogen peroxide, carbamide peroxide. But they're all, at the end of the day, some type of peroxide, and they're in lower concentrations than what you'd find in a dental setting. Because obviously the stores are not authorized to sell or use as high of concentrations as dentists can in their office. So, I mean, can they really damage your teeth? It's very rare. It's very rare for someone to damage their teeth using whitening products, just alone whitening products. If you're brushing really aggressively, that can damage your teeth, but that's kind of a different.
That's with or without the whitening.
Yeah, that's with or
Right.
without the whitening. But again, the whitening itself, really very hard to damage the tooth. The results that you'll get is highly variable. Most of the time, it's just one or two shades better. For people that are using the over-the-counter products, you're going to get a lot better results in the dental office, and if you really want to whiten your teeth.
Because it's more concentrated.
There's higher concentration, and there are things that we can do in the office setting. For example, making custom molds for your teeth that will fit exactly where these peroxide gels should go and things like that. And we also have special lights that we can use to activate these products and make things go faster.
I will say that with whitening, if you overdo it too, I'm not sure if you can overdo it with the over-the-counters, but if you overdo it, your teeth can become pretty sensitive.
Yeah. So that's one of the factors, even with the ones that over the counter,
Yeah.
sensitivity is one of the biggest kind of side effects. So for example, if you're eating ice cream, you get that, that twinge.
Yeah.
That can happen. And so what we normally say is brush with a anti-sensitive toothpaste.
Like Sensodyne?
Like Sensodyne.
Yeah, I think that's the only one I know, actually.
And also, if you get the gel on your gums, it can actually burn your gums.
Oh, so that's interesting. So we have a couple of minutes. Is there anything that we have not mentioned that we need to mention?
I'll say one more thing about the cosmetic part, which, we were talking about this before. The cosmetics, a lot of people these days are very concerned with cosmetics. But usually when you come to find a dental home and you come to the dental clinics, our priority is your health. And it's always good to make sure that your gums are stable, your teeth are caries-free or cavity-free, and then we talk about cosmetics and how to make things whiter and brighter.
All right.
Yeah.
So if a tooth is discolored because of medications, will the whiteners help that?
They can to a certain degree, but if it's medication related, there are other things that we can do. So we can do kind of use an abrasive type of disc to polish it, or we can actually do filling, so like what we call composite veneers, or even one step further, porcelain veneers.
So we just put a layer right over it?
Yes, right over it. And
that's good to know.
Yeah, normally we try, the most kind of conservative steps first, and then move on until the patient's happy.
Yeah.
Until the patient is happy, right? So that's good. All of this, and of course, I don't think we have enough time to go into these braces that people are getting them today at any age.
Right.
And I guess they work at any age. I mean, when I was a kid, the prime age for getting braces was 12. And if you missed that, you just didn't get them. But today, people use them at any age.
Yeah.
So maybe that's a topic for another time.
Yeah, that would be great. We
Yeah.
could definitely talk about that next time.
Yeah, well, thank you so much I hope you've learned a lot. I certainly have learned a lot. And it's much more about cosmetics and how teeth look. We have to keep that mouth healthy for the rest of our bodies.
That's right.
Yep.
That's right.
Thank you so much.
Thank you.
Thank you.